I'd like to welcome Dr. Eboni Cornish.
Hey everybody, there's a lot of familiar faces, a lot of patients, a lot of friends. I always call this my family reunion. Even though I got a lot of kids, I'm a mother of 19-month-old triplets, so you guys won't see me after my talk for that long. So if you have questions, you can email me later, get a card, because I won't be at the question and answer section this year. But it's another thing I wanted to give a good shout out to a lot of my fellow leaders and board members of ILATs that are here today. We got Ron Wilson, he's the chairperson of the Educational Foundation, Mary Ann Middleveen, she's on the board for the ILATs Educational Foundation. So it's just great to know that the leaders in the Lyme community are also having an impact in Morgellons and better understanding this disease and wanting to really help our patients. So I'm here, I work in Leesburg, Virginia. Here are my disclosures. I don't have anything to disclose. I'm not selling anything. I'm not buying anything. I'm not doing anything that you need to know about. And when I was coming up with this talk today, because I've presented for the past few years here, you know, I thought to myself, what am I always doing? Fighting. I'm always fighting, you know. I'm always fighting with myself about, like, am I getting mommy shamed about having all these children and working full time? My patients are always fighting with me. They come in, you know, great that we have so much information out there about Morgellons, and I learn something new every day, because let me tell you something. If someone says we have the cure, it's not true. There's no cure. We're at the infantile stages of understanding this complex illness, and we learn something new every day because we have researchers and pioneers on the front line who are doing this. And when I first started, I saw my first patient through the back door. She came in and I treated her for Lyme, and she's here. Say hi, Nancy. She's the reason I'm in this world. She introduced me. And I loved it from day one because, as you heard in my intro, I'm a researcher. I love to find out the why, and I don't quit. That's what all my patients tell you. I don't quit. I may not have all the answers right away. I don't look like Ginger Savely, and people come in like, well, I want you to do what Ginger did right now, and here's what I want you to do. And I'm like, she's my mom. And I call, Mom, let me tell you, somebody said this to me. So, you know, I would say 5% of my patients are sent from Ginger, and, you know, those people fight with me like, she told me to come to you, but you're not her, and do this. And I'm like, and I fight back, and I say, hey, I'm going to get you better, and we're going to do an individualized treatment approach. We're going to use a lot of things that you may not be familiar with, but I'm not going to quit until you get better. So that's also the fight. Because what I have found is, as I've learned, you know, over the last 8 years or so, how to better treat complex chronic illnesses, there isn't one template. You know, as the first two speakers, you know, Nicholas, Ginger, we have same approaches, but there's no one way. We are all humble enough to say, I don't know, but I'm going to learn. And that's what we have to do when you're thinking about the treatment of Morgellons. So when I tell these patients, I want you to keep fighting, being your own advocate, bringing information to your doctors, but don't give up. And don't get upset, because we're all learning every day. Now, the things that I talk about today, I'm not going to say are the official causes. I don't want anyone to leave this room today and say, Dr. Cornish told me this causes it, and that's what you're going to do. No. What Dr. Cornish is going to tell you, don't misquote me, because I have that happen a lot. I'm going to tell you are things that I think contribute to this complex disease, and some things that can contribute to the severe symptomology. Things that we need to look at, because we have research that shows infections. We're going to talk about that. So if you see under fighting, I have food, infections, gut, histamine, heavy metals, toxins, inflammation, neuroendocrine, and genetics. And this is kind of like, when I was coming up with this talk, it's what I use for all my chronic illness, not just Morgellons, but when I'm treating chronic Lyme, fibromyalgia, multiple chemical sensitivity, I use this. And I didn't realize till I wrote it down. Now, let's first talk about infections, okay? And we heard a lot about infections this morning. We're going to hear more later. So I'm not going to go in great detail because a lot of my family members will as we go throughout the day. But you want to make sure that someone's analyzing, Lyme and active co-infections, Bartonella especially, very challenging. Babesia protocols, Borrelia, you're looking at yeast and viruses, using anti-helminths if needed, and H. pylori. We saw in the literature that H. pylori can also be found in these collagenous fibers associated with Morgellons illness. And this is just kind of an overview. Oops, sorry, I'm behind on here. So yeah, there we go, catching up. So Babesia, Bartonella, Ehrlichia, kind of some of the co-infections, Rocky Mountain spotted fever, mycoplasma. We talked about chlamydia, pneumonia, and just looking at some of the symptoms associated. All right, now we're going to talk about the G, gut, and food. That's F and G in fighting. And patients who have seen me, they know that that's what I start with. I talk about the importance of the gut and the importance of food. And I tell them, if we don't change that, I can give you this wonderful cure you're seeking that I don't have, that's not available. But if I did and I gave it to you and you still ate crazy and didn't take care of your gut, yeah, you might feel good temporarily, but it won't last. So when I'm looking at, I'm a functional medicine trained doctor as well. I look at the 5 R's of remove, replace, rebalance, reinoculate, and repair. I think I'm going to use this. Hello? Is this on? Yeah, there we go. I like this better. I don't feel so hunched over. And when we look at removal, the majority of my patients, they do some type of test for food sensitivities, not necessarily allergies, because I'm not really concerned about what a patient is allergic to. I'm more interested in looking at what foods cause inflammation, because I find in chronic illness, you're dealing with complications with the immune system as well as the high inflammatory burden. So it's kind of like a war between the two. So when I'm looking at inflammation, I want to make sure I know what foods are causing sensitivities. I also want to make sure I'm doing my due diligence at removing, the pathogenic microbes or infections in the gut, that I'm looking for yeast and bacteria and parasites in the gut. And this is just an example of one of the many food inflammatory tests that are on the market. And I just put my own here so you can see it. I don't care. So this looks at restricted foods from a scale of 2 to 4+. So like I said, these are foods that will cause body inflammation. As you damage the gut, you release cytokines, and these foods cause you to feel inflamed. And prior to doing my test, I just had my babies. I feel like I ate pretty well, but I was tired every day. If you were my noon patient or a 1 o'clock patient, I probably just almost took a mini nap before you came in the door because I was so exhausted, and I just constantly blamed it on my kids. Oh yeah, I have a mom and I have kids and they don't sleep. But when I did my food inflammation study, I saw a lot of the things that I ate almost daily popped up, like wheat gluten, peaches, and I had like a peach almost every morning in my smoothies, casein, which is cheese, cow's milk, peanuts, egg whites, and I love my egg white omelets because they seem healthy. Pear, and I was having a pear every morning also in a smoothie of mine, and corn. So this test, showed me my list of foods on a scale, so I saw my reactivity to it. And so what I had to do, I work right next door in my clinic in Leesburg to our nutritionist. She gave me a plan, and she says, Dr. Cornish, you always speak about leaky gut and you're treating gut, you need to treat your own gut. And I was like, you're right, I'm kind of treating the gut. So I kind of removed these foods completely for about 4 months, and I noticed at 1 o'clock I felt better. I was able to get through my day, I had more energy with my kids, and then afterwards I started introducing them back, and I noticed the reaction to them. And that's usually what I have my patients do. I say, let's walk in. There are numerous tests out on the market that do this, but let's at least find out what's inflaming you. And let's see if adding that back will help you or cause you to feel differently. And this is just an overview of why gluten and glutamate, which is a part of MSG, is just so dangerous to the nervous system, all right? So gliadin from gluten is a major source of glutamate in the small intestine. And I'm sure you all have heard about MSG, and that's terrible. Well, glutamate is also neuroexcitatory. And this can contribute to kind of a leaky gut and allow the glutamate to then enter the bloodstream. And the problem happens when you have this free glutamate that's going around your bloodstream, and that's the neurotoxin. That's the problem. And it causes cellular death, and this has been published in the brain and the nervous system. Fast foods have a lot of free glutamate in them, And foods, examples, patients sensitive to gluten and MSG, canned chicken broths, they may not have added MSG, but they have glutamate in it, and they kind of get allergic reactions. And this is just a kind of a picture to show how gluten causes trouble. And if I had a pointer, I would point it out. The gluten proteins permeate through the intestines, and they damage the small bowel because around your intestines is like a fortress. You have these gut epithelial cells, like a fortress, because about 70% of your immune cells are in your gut. And the more toxins we're exposed to over time, they get like holes punched into the gut. So the good things leak out and the bad things leak in. And that's what causes that kind of inflammatory response that we're seeking to try to treat. Inflammation, all right? So you start getting these cytokines that are released, and that causes inflammation. Other way I look at it is fire, gut on fire, brain on fire, inflammation, forest fire. And this is just a little bit on, glyphosates and Roundup. You hear all the things about GMOs, but just understanding that it's been shown in the literature that they can cause, cellular damage and oxidative stress. So trying to eat as organic as possible. We're not saying that to stand on soapboxes when your doctors tell you that. I mean, it's shown in the literature. Trying to put less in your mouth is pretty key. And I tell patients, the patients who come back to me and they're like, oh, I'm still not feeling well, what's wrong with you? And then I do questionnaires at every visit, and do you eat this? Are you eating this? Yeah, I'm eating this. So what? I don't feel well, I'm eating all this. And I'm like, well, look at that glutamate, look at that gluten, look at that toxin you're putting in your mouth in one hand. In the other hand, look at your wallet and all the money you're spending seeing me. Paying for supplements and medications, and tell me what's the easiest, what do you really want to put down? Most people say their wallet, right? So I said, well, put down the food too, because that's easy, all right? And that's just for our chemists out there, what glyphosate looks like. It's active in Roundup, developed and patented in the 1970s, and since the 2000s, when Roundup patent expired, glyphosate is being used much more extensively in our crops around the world. And the Roundup ready crops have been genetically modified, those GMOs that we keep hearing about, to tolerate the glyphosates. They readily take up into the leaves, which allow them to eat, the animals to eat it. So corn, soybean, cotton, alfalfa, cow. So this just shows you things that are highest in glutamate. So you see soy and wheat gluten and casein. Those are the processed foods. So what I do try and I focus on in my practice is trying to make sure we have personalized nutrition. I'm not, a hypocrite. I'm not going to have you and say, eat rocks and paper, patient who doesn't feel well, and give up everything you know and love. But a lot of times when I do inflammatory testing and people see real data and they feel different, they start changing. But if they cut everything out and they'll say, well, I don't feel any different, then we have to find a balanced approach. And that's why I'm happy I work with a nutritionist, because when I used to do it without one, people hated me because I would say, listen, get rid of everything, eat nothing. And, sometimes you feel worse when you do that. But having that personalized approach is important, and trying to be realistic with your goals. I don't look at diet. I want lifestyle changes. So being that I'm someone who lived through that, and I know how important personally lifestyle and dietary changes are, I try to meet my patients in the middle, trying to make sure that at least I'll say, okay, if you can't change your diet, what is the worst thing in your diet that you need to get rid of? Let's start there. It could be as simple as soda, or trying to decrease chemical exposures to food, Decreasing gluten and sugar in foods, making sure you're eating organically, drinking 2 liters of water. Sometimes 12-hour fasting or intermittent fasting, 12 hours, can be helpful. A lot of times I'll have my patients do a liver fast. You know, the people who are here know about it, and I saw someone just roll their eyes, but hey, you've done it and you probably felt better. And that's just kind of 3 to 7 days of fruits and vegetables, but it's medically guided because I don't believe in those juice fasts and water fasts. No, you need some nutrition, all right? But just don't give up, and don't get mad at yourself if you try to change your diet and your Morgellons lesions don't magically go away, or you change your diet and that's not the only thing that gets you well and you don't feel remarkably better. It takes patience with all of this because you have to think about how long have you really been abusing your gut. Well, give it time to heal, all right? Just don't give up. And don't beat yourself up if you cheat. And that's why I tell patients all the time, just don't cheat too much, but don't beat yourself up if you fall off the wagon. Now, the replacement part of this 5 hours program is trying to replace in the gut the things that are needed, like digestive enzymes or, betaine, hydrochloric acid, and prescription enzymes that help you digest your foods into smaller particles. And then you want to make sure you reinoculate the gut, and that's using good probiotics. Now, it doesn't matter how many billion units. I heard a lot of people say that, I got a 200 billion unit probiotic that I paid $300 for, and I'm still constipated. Okay, well, that might not be the probiotic for you. Not every probiotic works. And, I have just learned by trial and error what may work for my patients, which may not work for you. But it is important that you have a probiotic that has research to support, because a lot of times these probiotics don't bypass the stomach. You want to make sure you have a company who's telling you, hey, we have this, and this probiotic can bypass the gastric acid that's being secreted in your stomach and colonize the large intestine. And that's important. So it doesn't matter how expensive it is or how many billion units it has. If you only get to the large intestine, it's 2 that are active. You need to really do some homework, all right? So, these are some of the common species and good probiotics, that have been published, like lactobacilli has been published to help with gut flora, and also bifidobacterium, which has a lot of literature, because if you notice, every day they have a commercial. Do you notice that? Like, are you constipated, diarrhea? They got, like, intestines walking around and basketball. Because even, in traditional medicine, we understand that the gut is key to wellness. It's the second brain. So in bifidobacterium, a lot of the literature coming out is showing how that organism can help with the mood, can help with fatigue. They have been published studies, okay? Not just helping with irritable bowel. Then they also have soil-based probiotics and yeast-based probiotics. So I didn't list every probiotic on the market, but some of the key organisms that are published, because they all have subspecies, right? I'm just giving you the overview. And then prebiotics, which kind of stimulate the growth of probiotics. So usually your fermented foods and vegetables, chicory root, garlic, natto, fermented raw milk such as kefir, yogurt, garlic, leeks. And then repairing. You want to make sure you still repair, because I told you it's like now that cute little fortress that was nice and tight is all, you got holes in it, it's leaky. So you want to find the right regimen for you, and like I want to emphasize, using antioxidants, using vitamins, making sure you're treating the gut mucosal barrier, and I have supplements listed here, some of the antioxidants like curcumin and krill oil, high-dose fish oil, vitamins A, D, C, B6, zinc, and making sure you kind of treat the gut mucosal border, get that border nice and healed with aloe vera. Things like lactoferrin can be helpful, even though you got to be careful if you're using that in the treatment of chronic Lyme, because that can treat, it's been shown in literature to treat biofilm, but bovine can be helpful. Glutamine, oregon oil, mineral broths. There are a lot of essential oils out there. And then medical foods, because what I find is that, you get so excited and you want to treat the gut, and then you look at the list and the patient has 5 pages of supplements, and you're like, oh, how can I consolidate that? So the best way to consolidate it, once again, I'm going to the diet, but then if you find certain medical foods that have multiple different agents, I find that patients tend to be more compliant with that. And this is just showing you, leaky gut can lead to leaky brain. And people don't understand how there's a direct correlation with your gut and your brain, all right? So once again, if you look in the middle, you have those immune cells, those leaky gut border I was telling you about with those holes. And you see these circles being activated. I wish I had a pointer, I'm sorry guys. But if you look at the circles in the middle, those are what's called cytokines. And that can be caused, the release can be increased by stress or infections, antibiotics, poor dieting. But if you look over to the green, you'll see that things that do help. Oh, thank you. That's fine. There we go. Thank you. See, that's why I said we're all family here. All right, now I can go on down here. Hey, hi. All right, so looking here, you have this, gut border here. And so, the bad things are leaking in, the good things are leaking out, and they're stimulating your immune cells, which then become hyperactive, overstimulated, because we want immune cells. But a lot of times when we have inflammation due to leaky gut, those immune cells become too active. So instead of targeting the bad stuff, it targets everything it sees. So it targets your cells, your muscles, it targets the foods you're eating, and so you have this high inflammatory burden. And those pro-inflammatory cytokines then can cross into the blood-brain barrier and cause neuroinflammation, brain inflammation. It can also affect what's called the hypopituitary axis and impact your cortisol and cause adrenal fatigue. But look at this. Those immune cells can also interact with these two things here called quinolytic acid and kynuritic acid, one of which is neuroexcitatory. But they also serve as precursors to neurotransmitters like serotonin, dopamine, norepinephrine. So when people say you are what you eat, that's absolutely true. One of the things I do right now is I work as an integrative medicine consultant for doctors with the Daniel Amen Clinic, which is a nationally recognized psychiatric clinic. And a lot of times by treating the gut, these people feel better with their mood. All right, so, and then you see this vagus nerve, which is directly connected. So, I'm not making it up. We do have to take care of your gut. And there are a lot of things out there you can do to take care of your gut, a lot of tests. This is just one of many examples of tests I use in my office. This is called the GI effect stool sensitivity study, the poop test. Morgellons patients, a lot of times they'll say they have things coming out their stool, they may see. And then I do the stool test because we want to say, all right, microscopically, what else can we see? So we test for infection, we test for inflammation, look for that insufficiency and look for imbalances. We also look at diversity of organisms because what has been shown in the literature is the more good organisms and more diversity you have in the gut, the less likely you are to have something called dysbiosis, which is imbalances and inflammation. So those are the things we interpret. And then the good thing about this test is one of the many tests that I use is because it'll show me exactly how to treat, these different imbalances. And then the next step, which is rebalance, which I think is key. And Mommy Ginger mentioned this earlier. Well, she might not be mommy age. I think it's more big sister, but she is my mommy in the field. Talking about mindfulness, doing certain applications, because that's the one question I ask patients. Okay, how are you turning your mind off for 10 minutes a day? What are you doing? Because I know I barely have time. How are you doing it too? And there are certain apps out there that you have no excuse. You can give me 2, 3, 4 minutes. You can close your eyes and do some deep breathing. You can use apps. Some of my favorites are Calm app, Chill app, Headspace app. Chill app, right before I came up here, dinged me and said, close your eyes, take a deep breath. I said, oh yeah, I forgot to do that today. So just 5 minutes or even 5 seconds. If you have kids, close the door in the bathroom. If you have a spouse, close the door in the bathroom. Give yourself 5 minutes. They're not going to hopefully go in there. But doing yoga is helpful. Meditation, not everyone can meditate, because people get stressed by thinking about everything. But like I said, start slow. Doing some deep breathing and, trying to get to sleep. All right, now we're going to talk about a focus of mine that I found more out from patients. A lot of this I learned from you guys. Because, you start doing these aggressive protocols, and I'm following it to the T. You know, one of the things when I first got into it, I called Ginger, like, I got all these patients now, and then she left DC, so I got even more, and I'm like, I'm following all the guys, I'm giving them all the antibiotics, all the antibiotics, I'm doing everything right, and they're still not well. And there was a lot of other things going on, you know, as I learned about, especially with the gut. I'm like, well, how am I dumb giving you all these antibiotics, but I'm not really taking care of your gut? Like, that's counterintuitive. But then another thing that I found, a lot of my patients who have, you know, food intolerances or, you know, just seems like they have allergies, they herx to everything, can only tolerate a drop of anything, and, you know, it's histamine imbalances, or a syndrome called mast cell activation syndrome, or heavy metal toxicity. So those are 2 H's in fighting. So I'm going to spend quite a few times. So you have to tell me if I'm running over, because, you know, the mast cell activation syndrome is something that I really got into, you know, the last year or so, just by my patients. And what these mast cells are, you know, they're immune cells or guards of the immune system that alert us when we have potential dangers. And when they're triggered, they release over 50 different chemical mediators, but the one that we know a lot about is histamine. And histamine, we've heard of it. We all know what histamine is. We take antihistamines, we see them, you know, we know what they are, Zyrtec, Claritin, et cetera. And it has numerous effects on the body. You know, it can include systemic inflammation and inflammatory cascades from the immune system. And so it drives both allergic and inflammatory response. And remember I said earlier, we're looking at this balance between inflammation and the immune system. It also acts on the brain as a neurotransmitter, and at elevated levels can affect mental health conditions such as anxiety or insomnia, depression, depersonalization disorder. And one article I read by Hamilton, which was published in 2013, it said mast cell activation syndrome is easily treated if it's recognized. And that's absolutely true. I have found that mast cell activation is one of the easier things that I can try to stabilize in patients who are suffering from chronic illness. And they usually go years without accurate diagnoses. And I think that it's not usually that this is the only thing wrong. And that's not what I'm saying about anything I'm presenting today. These are things that can influence chronic illness when you're looking at environment. Not the cause, but can make the treatment last longer. So influencing, all right? Now, they're widely distributed, mast cells are. They're found primarily in connective tissue and mucosal tissues, and the nerves, blood vessels, and the lymph nodes. There are a lot of them in the skin, in the lungs, in the GI tract, in the GU tract. And this is a great picture, because this was published in an article in the New England Journal of Medicine, which is a well-respected medical journal. And they had an article about mast because it's in a lot of terms. So you have histamine intolerance, you have mast cell activation disorder, or you can have mast cell activation syndromes, okay? What I'm talking about today is different mast cell activation syndromes, not really the disorder, because that one you need like hematologic. Sometimes you'll need bone biopsies to diagnose. But these are more disorders, all right? So you have activators. So these activators, when they make these cells hyperactive and degranulate, can be allergens, bacteria, cytokines or toxins, drugs, yeast, toxins, and viruses. So the problem is when they're overstimulated, right? So they break down, and like I said, they release over 50 different mediators. Histamine is just one of them. But look at the things that happen when they start degranulating uncontrollably. You can start having cardiovascular issues, so hypotension. I usually see that associated with a lot of my patients, as well as POTS, syncope or near syncope, lightheadedness, tachycardia, fast heart rate. Some of the other mediators can cause flushing, itching, lower extremity edema. You can also get some GI issues, cramping, diarrhea, reflux, nausea, vomiting. Musculoskeletal, so patients can have bone pain and osteoporosis, aches. Neurological, you get anxiety, depression, decreased memory, concentration, insomnia, migraines. Respiratory issues, how many people with allergies have nasal congestion or coughing or sneezing, shortness of breath or wheezing. And then systemically, you can get the fatigue, the general malaise, kind of weakness. So these symptoms overlap with a lot of other things. And this is just overview again of some of the other symptoms. So red eyes, irritated eyes. Just think of someone who's allergic. You know, you can also have tinnitus with these patients, like ear ringing, vocal cord dysfunction, your throat swelling, difficulty swallowing. And the psychiatric symptoms, you know, paying key attention to those, because I attest for it, and we'll talk a little bit about how to test for it. You know, my patients who have ADHD or ADD or, you know, anxiety, depression. I have a lot of patients who have interstitial cystitis. It can be a lot of times be from a, you know, tick-borne illness or a Bartonella etiology, but I've also seen it in patients who have this mast cell syndrome. Deteriorating teeth can be associated, you know, and a lot of anaphylaxis. These patients really can't tolerate things. You know, you worry, you're like, I know when I first saw someone with mast cell years ago, I didn't know what it was then. I'm like, yeah, right. I gave her 1 drop of this and she's in the ER, please, okay, whatever. But it was true, you know, they were hypersensitive. Some patients come, I can only eat 2 foods, or I react, or I can't take any antibiotics. So you have to think about other things that are going on, the why, not just the what, the why, all right? And some of the symptoms you see, the hives, you know, skin flushing, we talked about that. I've also shown, it's been shown in publications, people have cuts that don't heal, they have skin infections from yeast, they bruise very easily, you know, they have hive-like spots on the skin. So then I started testing, and I started testing even some of my patients, current patients who had Lyme, just like with my Lyme patients who I ended up finding out later had Morgellons. You know, I was treating them for Lyme, and then I learned more about Morgellons, and I'm like, oh yeah, she has Morgellons. So, you know, like I said, we're always expanding and learning. So these are the tests that you draw for mast cell activation syndrome, all right? Serum tryptase is the most famous mast cell mediator. You also can look at serum chromogranin A, plasma histamine, but that's not really that sensitive. So a lot of times you get the histamine elevations in 24-hour in methylhistamine. You look at urine prostaglandins and plasma, serum IgE. A lot of times your doctors will get, you know, immunoglobulins, but if you do like an immunoglobulin panel and you look at IgE, if you want to think of the IG Eboni allergic lady, you know, so remember things, that's fine. But that one has been shown in the literature to be associated with mast cell elevations there. And then you look at genetics. How do you treat it? And so I showed you in that other slide, I said it's easy to treat if you catch it early. So you want to make sure you're not giving a patient, you know, probiotics that can cause your histamine to be high. All right, I got 10 minutes, so I got to fly through. All right, so you get people on a low histamine diet, you do allergy testing, you check them for chronic illnesses, and then heavy metals. All right, so you use histamine blockers. You can use H1 blockers, some of the over-counter ones like Claritin, Zyrtec. H2 blockers, some of the ones we know we use for GERD, like Pepcid, Zantac. You can use what's called leukotriene inhibitors. You get on the right protocol, Singulair. Some mast cell stabilizers, like what's one called Nasocrom over the counter, ketotifen, which is a compounded antihistamine that you can only get from a compounding center. And then you can use natural antihistamines, you know, luteolin, Neuroprotect, Brain Gain. Those are some really good natural antihistamine combination agents that have been studied a lot more in the autism community, but are very useful in chronic illness. Quercetin, you know, ascorbic acid, omega-3s, NAC. And then you also want to look at something called MTHFR, or methylation donors, things like SAMe, methyl B12 or folate. And then probiotics that lower histamine, you know, some species like Lactobacillus rhamnosus or Bifidobacter. And then nutrition. And real quickly, you know, just making sure you're evaluated for heavy metals, all right? Then the T in fight is toxins. So we're going to really focus the last few minutes or so on one of the common toxins that I test for, which are mold toxins or chronic inflammatory response syndrome. Now, keep in mind, I'm not saying this is a cause for Morgellons. I'm just saying this is something else you need to think about when you're looking at environmental causes for illness. And this just shows here the Ritchie-Shoemaker protocol, which is the biotoxin pathway. And what it shows is that you get a lot of toxins, and your Lyme can be one of them, or an environment. Most people can remove them. And then in this elegant algorithm that Ritchie-Shoemaker has produced that we all use as a guide who practice in SIRS, in some way, shape, or form, you find that people have these genetic susceptibilities called HLA, which makes them more likely to hold on to mold toxins. And then that affects, those HLA or cytokines can affect numerous different systems. Goes to the brain or the hypothalamus. You have what's called leptin damage, which causes your fat cells not to respond to exercise and diet. You start having imbalances in certain, neurotransmitters and hormones, one of which is melanocyte-stimulating hormone. And when that's found to be low, you have sleep disturbances, pain, GI problems, prolonged illnesses, changes in your hormones, decreased sex hormones. You also want to make sure you're looking at methicillin-resistant Staph aureus or Morgellons, which is a bacteria in the nose that releases cytokines. And you want to look at other inflammatory, some of which are non-specific inflammatory markers like TGF-beta1, MMP9, C4A, because those inflammatory markers can fluctuate with the treatment of CIRS. So you make sure in all your patients, who have chronic illness, you take a careful environmental history. And you look at labs that test for biotoxin markers. I always have patients tell them if you don't remove the exposure, you're not going to get better if there is a mold exposure. So making sure you're doing, environmental testing if that's the route you decide to take. There are a lot of urine mold tests on the market. Real-Time Labs has one, and now Great Plains Labs has a more, a reasonably priced one at $300 that also looks at mycotoxins, but your doctor would have to order that. And then, looking at the inflammation. So some of the other things in SIRS, because this is evidence-based, and I told you I love research, you have to do the certain treatment steps. And this kind of gives you an overview of the treatment in SIRS, but the first thing you have to do is remove the exposure. You can have binders that you can use to bind mold toxins, but if you're still in that moldy home or going to that moldy job, you're not going to feel better. It's going to continue to perpetuate these inflammatory cytokines that are going to prevent your healing journey from any chronic illness, all right? So you can do, binders, get rid of the Morgellons, correct some of the androgens or all the different abnormalities in the labs. So this just kind of goes over the overview of treatment, but most importantly, you got to remove the exposure. And then really briefly, because of time, I'm going to touch a little bit on genes. So you can have something called methylation disorders, and this might be something you're familiar with. You've heard MTHFR, which is only one small thing in this huge global picture of methylation imbalances. I have a love for genetics, so I love learning more about this. But it's basically methylation disorders as you're unable to methylate folic acid and vitamin B12, which can lead to cell membrane impairment, problems with DNA synthesis, and inability to detox. So in the liver, in general, you have two phases of detox. Phase 1, you break everything down. Phase 2, you clear it, out of the urine stool. But you usually have what's called biotransformational imbalances between those two phases. So toxins start circulating, you get free radical damage, and you don't feel well. All right? Methylation can be a key component of this. And this is just a quick overview of the different components of the methylation cycle. Like I said, you always hear about, if you know anything about methylation, MTHFR, which is a very common variant. Doesn't mean if you have this, you need to run and do X, Y, and Z. You have to look at the complete clinical picture in a person when you're looking at genetic predispositions of disease, because there's not a doctor out there who can change your genes. You're born with it. You can't change your genes. But what we can try to do is if we look at the different cycles, and that usually requires when patients do, for my practice, tests like 23andMe or, Sterling app or, things to help me assess some of these different polymorphisms, I can possibly come up with some, nutrients that can help support methylation. Because I look at it as like, these cycles are all wheels that go together. These 4 big cycles here. And with the methylation cycle, I told you produce SAMe. SAMe just goes out and turns your genes on and off. It gives you a methyl donor. It becomes, turns into SAW, which becomes homocysteine, which then becomes glutathione. And we've heard a lot about glutathione before. It's our free radical scavenger. It's the Pac-Man that goes and cleans out all the toxins. Then you have a folate cycle, your ability to methylate or incorporate active folic acid in your cells. You have the biopterin cycle, which is how you produce serotonin, dopamine, and your numerous other neurotransmitter precursors, because we have a lot of literature that shows how methylation can be associated with mood instability. And then you have your final part, which is your urea cycle. Now, this is just a very elementary overview of methylation. So just going back to MTHFR, and I got this courtesy of Neil Rawlings, who's an expert in the field. MTHFR produces SAMe, leads to the production of SAMe, and also through certain enzymes, you can produce homocysteine. Homocysteine can be bad when it's elevated. It can lead to cardiovascular risk factors, okay? And then homocysteine by other enzymes is what leads to glutathione production. Another key thing is having methionine from your diet, which is proteins. Now, there are, what we know right now, most studies only refer to 677 of the MTHFR mutations. But there, in 2001, we found out, and probably now it's even more, 1,298 different variants, 7 other common defects, 34 rare defects as of 2003, and other defects in methylation pathway have been identified and are coming down the pipeline. Since the development of the Genome Project, we can now determine different polymorphism imbalances. So just quickly going over the common 2, that if you know anything about MTHFR, you know about these 2 variants, but keep in mind it's a whole big cascade, all right? So the one, the C677T defect, associated with the elevated homocysteine. You have an increase, some people, because just because you have a mutation doesn't mean you have the results. Doesn't mean it's expressed in everyone, okay? So you can have a mutation and be completely fine. But it's not really until the environment causes those mutations to be active that you may start having issues. So you're born with genetics. You haven't been sick all your life. But how does the environment cause those genetic variants to be active is what we look for, all right? So I don't want anyone to leave here and say, oh, yeah, my doctor told me I had this, and that means I have this. No, all right? So you have an increased risk of cardiovascular disease, have a risk of peripheral neuropathy, so that's kind of pains, neuropathic changes. They do have increased risk of blood clots and stillbirths, cardiovascular risk during pregnancy. And then the other common variant that most doctors are aware of is the A1298T. And this one is more associated with neurological, neuropsychiatric manifestations in the literature. So depression, anxiety, fibromyalgia, chronic fatigue, migraines, dementia, nerve pain, schizophrenia, Parkinson's disease. And then people have the compounded ones. And, since I've been in this field, I'll have patients who come they've been seeing a lot of experts, they may come with this MTHFR. And if you imagine MTHFR, and they say, I have the MFR gene. I'm like, that doesn't really mean you haven't. I've heard that, yeah. Because they have the compounded, and that's when you have one of each. So the symptoms are just more severe. Blood clots are more prevalent, and the immune system is more compromised. Now, the final stage of treatment is remission, because like I said, we're still in the infantile stage of understanding all the variables that contribute to chronic illness. We're using evidence-based approaches daily, and we're training other doctors how to use those approaches, but you want to use minimal intervention to achieve your baseline quality of life. I have patients, I tell them, you may be on maintenance. I really can't tell you it's going to take X amount of time, because you may take longer, you may take shorter, but it's going to take a lot of work. So when people say, how long will it take? I say, how long do you want it to take? Because 80% of this is you. I only got 20%. You have to do the hard work, all right? You want to repair the damage that causes the underlying illness. That's looking back at the inflammation, the different causes, especially if that includes infection. You got to use your nutritional support to maintain renewed health and a sense of well-being, and maintenance treatment so you can sustain clinical stability. So don't be one of those patients that get better and then you go missing for 2 years and you come back to your doctor like, oh, I know I've been missing, but I don't feel well again. You know, those are those challenging. You got to do some type of maintenance, even if it's by yourself. But it's usually best with a guided health professional to keep these symptoms at bay because we're dealing with complex illnesses that are multifactorial. So just because you feel better today, our goal is to have you feel better for the rest of your life. But unfortunately, you know, all of us who treat these complex illnesses can attest to it's a waxing, waning course. People relapse. But you have to think about other causes, the why, not the what. We know we can find out what the diagnosis is, but why are you still symptomatic? So that's it. Thank you.